better sense of this injury overall. Let's head to Dr. Desai of RestorePDX, who's joining us here tonight. Thank you so much for the time. So give us a sense. The third metacarpal on the right hand, basically the base of the middle finger is broken, right?
Yeah, it's the long tubular. Hi, Dan. I guess. So It's the long tubular bone in the palm of the hand. So it's kind of vertical this way. It follows in line with your finger, and that bone is broken, so it spans the length. Oftentimes, we see that with a direct impact injury to the wrist along this force and direction. You see that with boxers. It's called a boxer's fracture. And really the important thing is kind of the displacement of that. How displaced is it? Obviously, it wasn't an open fracture. So we hope if there's minimal displacement or angulation, we like less than about 15 degrees, then that can be splinted or casted. And we're looking at approximately a 6 to 8 week recovery time.
So 6 to 8 weeks, and that would put this season right into the middle of March.
About 11 games left.
About 11 games left in the regular season. And based on the abilities you've seen of some of these athletes to come back, one thing to have it healed in 6 to 8 weeks, another thing to be able to play basketball after that. But do you think there is a chance that you could see an Evan Turner, assuming that it falls within that timeline, be a productive member of an NBA basketball team before the end of this season?
Yeah, again, it really just depends on the amount of displacement. They're going to look at X-rays, and that's going to help determine that. How angulated is it? How displaced? Is there a hairline fracture? So some of those things really will determine that. The other thing it is shooting hands, so it's going to make it a little bit more difficult to come back and be really effective. And then the one concern is, and this is the end of the season, if they make a playoff run, the concern is refracture or re-injury. So it's really, they can get out, the athletes can get out there earlier than that 6 to 8 week time point. But their treating physician, what the X-rays look like, what their pain tolerance is, and then how confident they are in refracture is important. You see like Hedo Turkoglu and Kevin Love kind of re-injured those types of fractures, and they were out for prolonged periods of time. So you don't want to rush somebody back because there is a re-injury or refracture rate, and then you kind of risk longer timeout and potential surgeries.
Generally speaking, is this a fairly common break, a fairly commonly handled break for doctors to see?
Yeah, it's very common. I mean, any kind of impact activity, especially athletes. We talked about it's called a boxer's fracture, but you see it in many different types of contact sports. We see it in football. There's a number of basketball players. If you just look back over this past couple of years, there's several big names that have had this with Rondo, Turkoglu, Kevin Love, and the spectrum. And if you look at, there's 5 metacarpals. You have 5 bones to break, but then you have some that have come back relatively quickly, and those are the non-displaced, non-angulated fractures. And then you have ones that have required season-ending surgery. So it's very important to, number one, what does that X-ray look like? The angulation and kind of the overlap is going to be important. And so that'll be determined in the next day or two. Or if they already have an X-ray.
From RestorePDX, thank you so much for the time this evening. Appreciate all the information on the front. As once again, Evan Turner breaks the third metacarpal in his right hand, the base of that middle finger into the hand. And we wait to see how long it will take him to get back on the court this season.